Leader of the Senate.
Thank you, Mr. President. The sixth order of the day is the second reading of the Federal University of Medical Sciences and Biomedical Technology Bill 2022. Distinguished colleagues, you will recall that this bill was read the first time in this chamber on Wednesday, 21st of April 2021. Mr. President, you may wish to invite Senator Akinyelure to move the motion for the bill to be read the second time.
Distinguished Senator Patrick Ayo Akinyelure, Ondo Central.
Thank you, Mr. President. Distinguished colleagues, my name is Senator Ayo Akinyelure, representing Ondo Central. Mr. President, I move a bill for an act to provide for the establishment of a Federal University of Medical Sciences and Biomedical Technology in 6 Geo-Political Zones and for matters connected therewith, 2022 SB 678, second reading. I so move, Mr. President.
You may proceed.
And biomedical technology and for related matters. Mr. President, distinguished colleagues, permit me to lead the debate on the general principle of this important bill, Federal University of Medical Sciences and Biomedical Technology Establishment Bill 2021 SB 678. This bill was read for the first time on the floor of this Allo chamber on 21st April 2021. Background: the recent global outbreak of COVID-19 and the spread of the virus mutation through the emergence of many variants in UK, USA, South Africa, and Brazil made it imperative that developing countries, especially Nigeria, become more proactive in the readiness to research and prevent future outbreaks. Reports show that Nigerians in the diaspora are deeply involved in the research and production of the life-saving COVID-19 vaccines developed by Pfizer's Pharmaceutical. Also of note is the appointment of a Nigeria by President Joe Biden of the United States of America as senior policy advisor on the COVID-19 pandemic response in the White House. Nigeria is blessed with highly intelligent and talented people. What is missing and required, which this bill seeks to provide, is the enabling environment and infrastructure to harness the abundant human resources available in Nigeria. Establishment of these universities and specialized centers of excellence in the field of medical in the field of medicine and biomedical technology research will provide the much needed infrastructure to achieve this objective. The establishment of these universities will be an avenue, Mr. President, for income generation, for self-sustenance, as well as source of income into the Federation account. The result of research findings will be available and marketed to the whole world. Partnership with established international private sector, especially in the medical, pharmaceutical, and allied companies, will attract the much needed foreign investment into the country. Justification for this bill. Mr. President, distinguished colleagues, it will be recalled that the Senate has legislated on 3 related institutions. This bill, however, seeks to provide a unified legal and legislative framework similar to the Federal University of Technology Establishment Act for the existing and other Federal University of Medical Sciences being proposed in this bill, and for further future requests as shall be presented for consideration by the Senate of the Federal Republic of Nigeria. Mr. President, most respected distinguished colleague, it is on record that the Senate had earlier passed 3 different bills, establishing each a Federal University of Health Sciences, Otupo, Federal University of Medicine and Medical Sciences, Abeokuta, Federal University of Medical and Health Sciences in Ekiti, while the National University Health and Medical Sciences, Suleja, is still under Senate consideration. This bill, when passed, we provide a platform for established 18 federal universities of medical sciences and biomedical technology, with at least 3 universities of medical sciences and biomedical technology in each of the 6 Geo-Political Zones of the Federation. Mr. President, distinguished colleague, statistics from JAM in 2017 show that the existing medical tertiary institutions in Nigeria have been less than 20% annually of candidates desirous and qualified to study medicine and allied sciences in Nigerian universities. Mr. President, if this bill is passed, it will support the establishment of 18 universities of medical and biomedical technology, with at least 3 universities of medical sciences and biomedical engineering technology per geopolitical zone at first instance, and will help address the drought in admission of students aspiring to study medicine and allied sciences in Nigeria, and the supply of needed manpower in our healthcare service sector, while the enormous stress posed by the teeming Nigerian population on the available national health infrastructure and available health personnel will be reduced. This bill, when passed to law, will also bridge the huge gap in doctor-patient ratio, as well as in medical research and production of pharmaceutical products, with huge potentials to make Nigeria a medical education and health tourism destination. Mr. President, the Senate of Federal Republic, respected colleague, permit me to further bring it to your notice that the fact that Nigeria has only about 72,000 nationally registered medical doctors, with only 35,000 practicing medical doctors, serving a population of over 200 million people, with doctor-to-patient ratio of 2,777, as against the World Health Organization WHO minimum recommended ratio of 1 doctor to between 400 to 600 patients. This is grossly inadequate, Mr. President, and require very urgent and collective intervention by the Senate. Conclusion, Mr. President, distinguished colleagues, I wish to submit that when this bill is finally passed to law, the next Senate will be sufficiently laid down an unprecedented foundation which will put Nigerian healthcare sector on a global map that will endear our national healthcare development plan. Financial implication. In line with Order 77.3 of the Senate Standing Order 2015 as amended, a compendium of financial implication of the establishment of each university of medical sciences and biomedical engineering technology is hereby attached. I therefore, Mr. President, urge my distinguished colleagues to support this bill to be read for second time. I so move, Mr. President.
Distinguished Senator James Manager, Delta South.
Thank you, Mr. President. My highly respected colleagues, James Manager, CEO in Delta South. Mr. President, I rise to support this bill for so many reasons. This debate itself is comprehensive enough and self-explanatory. Mr. President, universities are known worldwide as centers for the advancement of knowledge and where researches are being carried out on a daily basis. If not for financial constraints, universities are supposed to be everywhere. And talking about Nigeria as a country, Nigeria of yesterday is not Nigeria of today. As we speak, not less than 100, 200 children are being born every day. And the population is exploding, no doubt about that. Communities are expanding, states are expanding, the country itself is expanding, Mr. President. And of course, diseases, new diseases are coming up every day. And you have epidemics that are ravaging the pandemic of COVID. It's here with us. It's well with us. And therefore, when you talk about establishment of universities, particularly targeted at training of medical personnel, the importance cannot be overemphasized. Mr. President, I support this bill in all ramifications. And I hope and pray that we will have the wherewithal to be able to withstand all this. I'm sure with what is happening in the country, it may be difficult, but I think with God And with the type of brain that we have, we'll be able to conquer it. Mr. President, I support this bill, and I urge my colleagues to also lend their support to this bill. Thank you, Mr. President.
Thank you very much. Is anybody against the bill? Those in favor that this bill be now read a second time, say aye. Those against, say nay. The ayes have it. Clerk of the Senate.
Mr. President, distinguished senators, a bill for an act to provide for the establishment of the Federal University of Medical Sciences and Biomedical Technology in the 6 Geo-Political Zones and for matters connected therewith 2022, SB 678, second reading.
A bill for an act to provide for the establishment of the Federal University of Medical Sciences and Biomedical Technology in the 6 Geo-Political Zones and for matters connected there with 2022 second reading taken. And the bill is referred to the Committee on Health to report back within 4 weeks.